What the McCain plan would do is tax health care benefits, which is an incredibly radical, revolutionary idea. Since World War II, companies have been able to provide you and me and anyone who works for a big company with health care benefits that we don't, as employees, pay tax on.
Right.
McCain's saying we're going to dismantle that entire system. So many companies would drop their plans.
Right.
According to a 2007 survey issued by the Kaiser Family Foundation, the average cost of an employer-provided family health insurance plan is $12,000 a year.
Because they can't buy any more health care for you than you can buy for yourself.
Right.
They would drop their plans. You would get more take-home pay. Right? Which would then be taxed. And he would make up for the taxes under his plan by giving a tax rebate of $2,500 to $5,000, depending whether it's an individual or a family.
According to a 2007 survey issued by the Kaiser Family Foundation, the average cost of an employer-provided family health insurance plan is $12,000 a year.
What the McCain plan would do is he would say, look, if you don't spend the money, you get to keep it.
But if I may, Senator, the Democrats pointed out at the convention that you have voted 17 times against raising the minimum wage. They say the only reason you voted for it in 2007 was because it was linked to war funding.
Well, the point is that I have voted to keep taxes low. I'm for the minimum wage increases when they are not attached to other big spending pork bill. But the practice in Washington is attach a good thing to a bad thing. And
However, McCain has explained to reporters that the employer tax deduction would stay in place and reform the tax code to eliminate bias towards employer-sponsored health insurance. McCain says he also supports insurance plans that are multi-year and portable, so if you change your jobs, you could still keep your coverage.
Very unhealthy system that has led to gold-plated plans that, that are not free and giving people much more health care than they really need, and a lot of spinal manipulation and going to the dermatologist, and that is not essential to maintaining health. And
yep, everything's fine. And in fact, I got the full cancer check a couple of weeks ago with my dermatologist. No, I just went to a regular routine that I go to my doctor all the time. I like most Americans, I go see my doctor fairly frequently.
Universal coverage. Barack Obama says his plan for a healthy America will get the job done, though children are the only group required to get coverage. Here's how the Obama plan accounts for 47 million uninsured Americans. It would create a new national health insurance exchange. Through the exchange, Obama says any American will have the opportunity to enroll in a new public plan or an approved private plan. The public insurance program would be available for Americans who don't qualify for current public plans like Medicaid or S-CHIP, or who don't have access through their employer insurance. This plan would also be available to the self-employed and small businesses. According to Obama's campaign site, no one will be turned away because of illness or pre-existing conditions, and the public option would be portable and similar to the plan available to federal employees.
We put forward a plan that makes sure that it is affordable to get health care that is as good as the health care that I have as a member of Congress.
As for premium cost, Obama says people who don't qualify for Medicaid or S-CHIP but still need help will be offered income-based sliding scale subsidies. According to his site, all plans in the exchange must be at least as generous as the new public plan. The senator from Illinois would also require that employers contribute money towards their employees' health coverage or towards the cost of the public plan. Obama officials say financing would come through the expiration of tax cuts to Americans making more than $250,000 a year. Much of the costs are also expected from savings within the healthcare system.